Welcome back, everybody. You're watching The Morning Show. Happy Wednesday. It's hard to deny that fall is around the corner, which means our changing needs for skincare. Kyle Richards from The Real Housewives of Beverly Hills is also here, and she's got great skin, so you know what you're talking about. And Dr. Julia Carroll, who is a dermatologist, and you've come with tips for every decade.
Yeah, so as fall comes along, you know, people need to know that they need to transition their skincare a little bit. So for fall, we want to keep it streamlined, but still quite simple. And so we're going to be decreasing the SPF a little bit, exfoliating, trying to get some of that summer sun damage off. And then now that we're not as tanned, we're going to be looking at doing some in-office procedures as well.
And it's very tough to go into a drugstore and start to make sense of what you need to buy, because there's a dozen choices for moisturizers. Yeah. How do you make sense of the drugstore?
Well, one of the things I tell people is you want to look at active ingredients and you want to look at numbers. So if something has a percentage on it, then you probably think that that's actually going to do something, versus something that just says contains vitamin C. You want to see that it contains X percentage of vitamin C, or that it has X percentage of glycolic acid. So that's helpful. And things that say, you know, reduces the appearance of, you know, reduces the appearance of doesn't reduce a line, it reduces the appearance of a line. So just be careful with that.
That's a little tricky there.
Yeah,
yeah. People really fall into that trap and buy that stuff.
Yeah, so I'd say look at the back of the bottle, not at the front of the bottle as much.
Read the fine print, and you've brought some models because, as we said, we wanted to take care of your needs for every decade. So starting with your 20s. Some people in their 20s probably think, I need maybe just a moisturizer and that's it. What do I have to worry about?
So we have here Sarah. She is our Canadian Studies student from U of T, and she's really, really good with sunscreen. But because of that, she's had a little bit of some breakouts over the summer. So what we're going to do for Sarah, we're going to look at using a exfoliant. So this is 8% glycolic acid by a company called Reversa, and so this one right here. And that's going to help with a little bit with fine lines, a little bit with acne, and just getting, again, some of that summer exfoliation happening. And then the next one is a product called Hydrophase UV by La Roche-Posay. And I like it because it has SPF in it as well as a moisturizer. It's nice and light. And then the third thing I'd suggest for Sarah is a new treatment to Canada called Isolase 2. It's a laser that does red and blue light. At the same time, it has a vacuum that takes sebum out of the skin. So unlike most acne treatments, this treatment will immediately improve the appearance of acne, rather than most which kind of make it worse before it gets better.
And it makes sense that if you're taking care of your skin in your 20s, that it gets much easier later
start
in life.
early.
How important, I mean, we always talk about drinking water, drinking water. In my 20s, I used to think, I don't see the difference. Now I do. Now it's like really makes a big difference.
Yeah.
I think water keeps your skin healthy, but if you actually look at where that came from, it was an old myth from a magazine in the 1950s that said you should drink X amount per day. And, you know, the quality of your skin day to day and water consumption isn't tightly linked. Bit of a myth.
All right, well, let's bring in the next model. Okay. So what to do when you're in your 30s?
32-year-old Allie, right?
Okay. So this is Allie. She's a competitive sailor, so she's been sailing all over the world this entire summer. She's pretty good with sunscreen, but she does have a little bit of pigment that we're starting to see. So one of the things I've suggested for Allie is that she can reduce her sunscreen a little bit. One of the things I really like are mineral makeups. This one here is by Maybelline. It has, L'Oreal. And it has an SPF 19 in it. You know, it's not as high as we'd necessarily like, but she's working now. She's indoors. That's going to be sufficient. And then I want to get her started on a retinol. So the one I have here is the Roche-Posay Redermic R, and it's going to help exfoliate. So again, it's going to start helping to work on those fine lines and a little bit of pigmentation. And the last thing I'd suggest for Allie is the Clear and Brilliant laser. And this laser is a no downtime laser. So it gets rid of pigment, it tightens pores, and she can do it. She'll look a little bit pink, but then the next day she can absolutely go back to work even that afternoon and look great.
What is the cost of something like that?
It's about $400, and if you do it in a package, it does tend to be a bit less.
It's great tips, especially if you love the sun, right? And let's bring in our 42-year-old Kayla.
So this is Kayla. Kayla has been a sun worshiper her whole life. And so
Yes.
I'm guilty of
I
that.
know, exactly.
So I'm going to maintain that she still needs to use her sunscreen quite diligently. So the things I think she should introduce into her fall routine would be antioxidants. So we have SkinCeuticals CE Ferulic, which is available in doctor's offices and some high-end spas. And then, so I've spoken about this before, and it's an antioxidant. It's going to reverse some of the sun damage. And then they also have AOX eye gel, which just came out in Canada last week, and it's basically a lower percentage vitamin C that you can use around the eye, so it's not such a sensitive area. So that's going to help lift off some of the pigment and just protect her from the sun even further. And then a retin-A, this is a prescription, but I think, you know, most people late 30s into 40s should definitely be using a retin-A if they can tolerate it.
Is that like glycolic acid?
It's a bit stronger. So this one is a glycolic acid, and the retin-A is a prescription version, and it's basically like the big sister to the glycolic acid. So it's going to take off some of the pigment. It's going to reduce fine lines. And then finally for Kayla, once she's lost a little bit of her tan, I want to do something called a South Beach peel. So this is another.
What is that?
Yeah.
I know. She's
think I
like,
need to do
I've never
this.
heard of that.
So this is a laser procedure where we're going to combine broadband light, which is, or otherwise known as IPL, so it's going to take off some of the pigment from her skin. And then we're also going to do a really fine micro laser peel, which will take off the surface. So it's going to improve texture, it's going to improve color, and it's just going to give her a really nice glow going into winter.
Wonderful. All great tips as we head into fall. Dr. Julia Carroll, thank you so much for all of those ideas. We're going to take a quick break. Kai Richards will be back for the national show. You're watching The Morning Show.